Our vision is that every country in the world should have an integrated health hotline and messaging service that allows people to have access to accurate and timely health information, which connects them to government services, and which also allows government to have data that they can use to predict and respond to outbreaks, and can also allow the community to continue to give feedback to the health system so it can continue to get improved. So that's our vision.
At the core of our strategy is what we call responsive primary health care. What does this mean? This means that communities have health care that is available to them where they need it and when they need it. It is adaptable, meaning when there are shocks and risks, it can withstand this, it is resilient, and then it should have all quality aspects of health services.
Most of the people running telehealth interventions in Zambia have not or engaged in some way directly with Ministry of Health, or they have gone through either a donor fund and the ministry does not really have visibility of where these people are operating or how they're operating those projects. Data discrepancies. So partners managing call centers typically do not share the data with the government. When we spoke with most non-profits, they told us they don't send the data they have to government. So they have critical information coming in from the community, and either if it's not a donor requirement for them to submit that data, it just sits there or goes to waste. And sometimes they don't even capture that data. They can record calls, but they're not sharing it and it's not being used by anybody. Missed opportunities. Some call centers have the capability to track epidemic responses and pandemics. However, they face challenges due to lack of user-friendly dashboards, making efficient data triangulations difficult.
We are also going to develop a one-year roadmap that we are going to use for the first year to allow the government to actually kick that off. What we're expecting is that once the 5-year strategy has been developed, then the government is going to use that as a guide to expand the utility of the call center.
As the representatives of the medical profession in the country, we are privileged to have this data at our fingertips. So maybe going forward, and as we advance, we could look at methods of collaboration so that you have access to this data.
There's a lot of discussion and excitement about things like AI and stuff. How can we leverage what's happening in this atmosphere? What are opportunities that we can leverage or we can get in terms of integrating AI, for example? And then for threats, I think Jessica also mentioned something about load shedding, right? What are things that are happening within the external environment in Zambia that could possibly hinder us from this, from actualizing this national hotline?
So a key takeaway from the cholera response that we saw is that when telehealth solutions are already in place in country and within existing health systems, they respond better to shocks and stresses to the health system. Unfortunately for us, the time period that we had to respond to the cholera response was not long enough for us to really create a coordinated approach and get the right stakeholders in place.
The current generation of people want to have personalized conversations, and I think that we need to change the way we engage with the public, because I know without doubt, and I've been a researcher for many years, and I've done a lot of these behavioral things. I think they don't work. So the least we can do is try something else. I think we must not just be doing the same things. We need to try something else. And I think that setting up a functional call center is one thing. And I think as we attribute that importance to the call center, it must no longer be the way you look at historical telephone operators. Historical telephone operators were looked at the same way you look at cleaners, the same way you look at the people who make tea for you. They just answer the phone. And I think we need to come out of that frame, and we need to think that these are frontliners. They are the ones linking us directly with the people we wish to impact, people we wish to communicate to. And communication really, as you all know, is a two-way process. It's not about you telling all the time. It's about you listening sometimes and you communicating sometimes, and both ways go.
What we were trying to do now in partnership with VillageReach, who have had vast experience in other countries in setting up what they are calling Chipatara Chapa phone, is to be able to inform our public what is happening, what are the disease threats, to be able to respond to other concerns. So it may be about pregnancy, maybe somebody is pregnant, they don't know which antenatal service to get. We want to be able to provide that.
So I think we are on track. There are other areas we need to look at, but as a group, I think we will get a good product. Malawi is really a good example because VillageReach started this over 15 years ago with the government and has since been transitioned to the government to manage with all the infrastructure, the human resource, recording now I think over 3,000 calls a month, and really has been deployed in the emergencies they have had, the cholera epidemic during Cyclone Freddy. So we think Malawi being a neighbor, and Lucky is here who has been in it, we should be able to get a product that can satisfy the needs of Zambia.
We're able to send direct messages or blast messages through the WhatsApp. So that is what we have prepared at Reach Digital Health. We were able to support the cholera response by just providing health information to prevent misinformation and just to provide information as well. So we also offer the help desk where you can speak to an agent directly through WhatsApp if you have a personalized question as well. So for now, the information provided is prevention, treatment, and more about cholera, really. But this chatbot can be expanded to so many other things, like what we've done in Mozambique currently. We're doing immunization, maternal health, where we're able to send reminders for the appointments, but also for the immunization reminders for the different stages for the baby to receive their immunization. Thank you.